Hi, so welcome to the Amphizoology podcast. On this episode, we are delighted to welcome Dr. Elizabeth Ormerod. So Dr. Ormerod is a veterinary surgeon who is the chairperson of the Society for Companion Animal Studies, which is how I first became acquainted with Elizabeth and all the wonderful work that she does for people and animals. As a small animal house physician, Elizabeth was responsible for Glasgow University's inner city charity veterinary clinic, during which period she became attuned to the significance of companion animals in the lives of vulnerable people. With multidisciplinary collaboration, she developed veterinary outreach programs, delivering animal-assisted programs to schools, nursing homes, hospitals, sheltered housing, and prisons. So my name is Chris, and my research focuses on cat-human relations. Also, I have been involved with the Society for Companion Animal Studies, SCAS, since 2021, serving as a communications officer and joining the board at the end of 2023. So I'm delighted Elizabeth has agreed to join us today.
Hello, I'm Sarah, and I'm studying unconventional shark-human relationships through a post-human lens. And I also have a passion in advocating for and researching abandoned cats in Saudi Arabia.
Hi, I'm Michelle, and my research has traditionally focused on human pachyderm relationships through the lenses of tourism, conservation, and One Health. I'm also lucky enough to have received a SCAS grant, along with my podcast colleagues, to study the human-cat and dog-human relationships in Nepal. We want to discover how to better support emerging bonds.
So welcome, Elizabeth. Perhaps you would like to start by telling us a little bit about your backgrounds and why you became a vet.
Well, we need to go back to my very early childhood. I was very fortunate in my family. My father was an agricultural engineer specialising in refrigeration, which meant that he worked in farms across Scotland. And I was actually a very difficult, hyperactive child, probably ADHD. And my mum used to send me off to work with Dad before going to work with parents was a real thing. So I got to go to farms across Scotland with Dad, and it was very interesting. Most of the farms at that time were mixed, so they had a variety of species, and I was able to interact with lots of different animals, puppies and kittens, lambs, goats, adult sheep, pigs, cattle. I found it absolutely fascinating. And once I started school, I was able to go with them during the school holidays. And I actually stated when I was 3 years old that I was going to be a veterinarian. The farmers found that hugely funny, and they turned me into a bit of a comic piece. So whenever I arrived on a farm, the farmers, who all looked the same to me, in big brown dungarees and huge wellies and red faces, would tower above me, and they would say to all the stockmen, "Ask her what she's going to do when she grows up." And I'd stand there and I'd look up and go, "I'm going to be a veterinary." And they'd burst out laughing. Anyway, it made me determined to do well at school because I knew it was difficult to get into college. So I studied really hard and I got into Glasgow University. And I actually was drawn to the human-animal bond from a very young age. And I wondered what dogs and cats were thinking about their owners. I didn't have a dog. I had a goldfish. And every birthday and Christmas, I would plead for a dog. And every birthday and Christmas, I got something else. And I was incredibly disappointed. When I was 11, my parents' friends had a border collie with serious behaviour issues, and they couldn't cope with him. And they were getting divorced. And my mum said, "Oh yes, we could part share the dog." So we were to have him from Monday to Friday, and then I was to take him home 3 miles away on a Friday evening. And on the first Friday, I took him home, and he was back home at our house before I got home. He didn't want to go home. So, but he'd lots of behaviour issues. He had enamel hypoplasia and he'd never been vaccinated. So I think he was one of the few dogs at that time that survived distemper. And I think that affected his behaviour. He was a biter. And I loved him dearly. And every time he only bit me or my dad. Every time he savaged us, my dad was on the phone to the vet to have him euthanized. And I pleaded and pleaded and pleaded. He was like my brother to me. I could not part with him. Anyway, my parents, we didn't have him euthanized, but it was very difficult looking after him, and I could never have friends round in case they were bitten. I had to be very careful. I'd get up at 5 o'clock in the morning and exercise him so he could be off leash, which was actually quite dangerous. And I was attacked one time. I never told anybody. The guy that attacked me, I broke his nose and he let me go. But it made me really in tune with people with pets with behaviour issues. So when I had my own practice, I worked very hard to help people with pets with behaviour problems. So on qualifying, I was again very fortunate. I was assigned to work in the university's inner city charity clinic. And this was a real baptism of fire. My clients were people living in very, very difficult, challenging situations. Most were unemployed, had chronic ill health, or were disabled in some way. And they were living in areas in Glasgow of high violence and economic depression, social deprivation. But what I learned was that if people had a strong bond with an animal, they could cope. I think of it as being like being in water in a storm, but you have a life jacket, or you have a life raft. If they had that bond with an animal, they could cope with all sorts. So I ran that clinic for 3 years, and then I went into private practice in Oxford. And I didn't actually enjoy that because there wasn't the challenge to help people with the social issues. After 3 years, my husband and I, he's also veterinarian, we bought a practice in Fleetwood, a fishing port in Lancashire, which is a town with recognised health and social needs more than the surrounding areas. And I just saw a wonderful opportunity to work with the local town to see what we could do with our knowledge of veterinary medicine, animal behaviour and animal welfare and the human-animal bond. What could we do for our town? And ours was the only permanent vet practice in town. There was another practice with a branch, but I felt I wouldn't be standing on anybody's toes if I went into schools and the nursing homes and the hospitals and the disabled living centres and the nursing homes. Looking back, the other vets wouldn't have wanted to do that anyway, but I had free rein to go into all these establishments. So I had 4 main aims. I wanted to teach animal welfare education in primary schools because most of the problems that we see in practice are through lack of education. So animals suffer just because people don't know how to care for them. They love them, but they don't know how to properly care. And I thought it would be very difficult because I don't have a teaching certificate, that the schools would say, no, we can't allow you to teach, you don't have a teaching certificate. And our curriculum's too crowded. But I wrote to all the head teachers and didn't get any responses. So that really confirmed my suspicion. I wanted to introduce suitable resident and visiting animals for all the care facilities, of which we had a lot in town because the town is by the sea and has a lot of disabled living centres and care homes for older people and a couple of hospitals. And I wanted to teach the other professions about the human-animal bond and how it applies to their work. And the other main thing was to get pet positive inclusive policies for the shelter accommodation. Because when we went there, that really wasn't available to older people. They had to give up the pets. Most of them had to give up the pets to go into supported living. And I thought that was dreadful. And that was going to be, that fourth aim was going to be so easy because that's a no-brainer. I would just have to go to the local authority housing committee, give them a presentation, they would all vote yes, and then I would concentrate on everything else. But I would follow up what happened when we introduced pet inclusive policies, and then that could get rolled out across the UK because it would be so positive. Well, plans went awry, didn't they? So one day I was passing a school and I had 15 minutes before my next appointment. So I thought, well, I'm just going to challenge the head teacher. So I went in and I said, could I see the head? I went through and he said, tell me about yourself. I said, well, I'm the new local vet, and I would like to introduce animal welfare education to primary schools. And he said, well, that's wonderful. When could you come? Could you come next week? And I said, yes, but why didn't you respond to my letter? I wrote to all the head teachers. Not one of you even picked up the phone or wrote a letter back. And he said, headmaster secretaries. They read all our mail, they decide what we get to read. They said, all your letters will have gone in the bin. He said, pick up the phone and speak to the head, or call in like you did with me. So I did that, and I then was in teaching at all of the primary schools, except one. And I found out a few years later that this was one of the Catholic schools, and the priest had put a block on me because he thought I would be introducing the children to birth control via spay neuter lessons. Now, interestingly, one of my children is now deputy head in that school. So I do get to teach. All these many years later, I do get to teach in that school. So that was interesting. So I started teaching in primary. Then the kindergarten teachers wanted lessons. So I adapted the lessons for the tiny children. And then the senior teachers asked, would I come and teach in the PHSE lessons and also teach to the children that had been excluded from lessons because of bad behaviour. Then the governor of one of the local high security prisons in Lancashire heard about it, and he asked me to go and see him. And he actually asked me to introduce what we then called an animal assisted intervention programme for the lifers group. And so that was actually the first planned AAI programme in a British prison. And we had a multidisciplinary team, people from all the different professions that worked in the prison were on a committee, and we planned it all very, very carefully. And it was very interesting. I actually had some concerns because, there's a link between people that abuse animals and abuse people, and people that are in prison have abused people. Therefore, were the animals going to be at risk? I can honestly say that the care that I've seen animals getting in prison is higher than generally they get in the community. And when animals have become ill in prison, people have gone to extraordinary lengths to support and nurture them. And I did come across a few instances of animals being neglected. What happened was that the other prisoners, if they see that somebody's not taking enough care of their animal, they will remove the animal themselves and place it with a trusted person. So that was a revelation. One of the most poignant things was meeting a man who'd been in prison for decades. And he had a little budgerigar who was very tame. And she was sitting on his hand, and he said, Mrs. O, until I had this budgerigar, I had never in my life had a relationship based on unconditional regard and affection. And the tears just rolled down my face. I thought, this is so awful. But the prisoners that I worked with, they were remarkable. And they were so interested in learning about animals and the proper care. And they went to extraordinary lengths to give the animals a good quality of life. But they could actually see parallels between their lives being confined in prison and animals being pets. Animals that are pets, they felt could suffer too much confinement and they needed an environment enrichment. So they made great efforts to give their pets very high quality of life. So I went to all the nursing homes in town. What I did was I had Wednesday afternoons off. So my Wednesday afternoons became the days that I would go and visit people from other professions and health and social care facilities. And the thing was, I'd go into the nursing homes and the staff would be there to greet me and we'd have tea and biscuits. And I'd spend probably half an hour telling them about animal-assisted interventions and why it was important that people who lived in care facilities had animal companionship from resident animals and suitable visiting dogs, and that I would help accredit the animals, etc., etc. And then they would say, "That's really interesting. Would you like to come and meet our pets?" So they all had pets, apart from one hospital. They all had pets. They hadn't the pets that I would have selected. And some of them had visiting dogs that I definitely would not have selected. So one of them had visiting dogs that were guard dogs for a security company. And one of them had a dog visiting who was actually the most dangerous dog in town. It's unbelievable. A dog that could only come to the surgery by appointment and we'd arrange that he would come when there'd be no clients in the building. The staff would be locked away in another room and only my husband and myself would see him with the male owner. He would be muzzled up in their car and we would be very, very careful about how we handled this dog. So when I went to visit a nursing home for people with dementia, I'd been invited by the manager who wanted to introduce a couple of resident cats. And while I was there, my client with the dangerous dog came up to me. "Hello, Mrs. O. You'll be pleased to know that Jack comes here every week."
Did he ever have an incident?
Well, I told the manager that Jack must never, ever visit again. I mean, this was one of the things that got me involved with the SCAS Code of Practice about the need for safe practice. It's so important. A lot of people, they hear about animal-assisted services and interventions and they just think, "Oh, that must be quite easy to do. I've had pets. My kids have got pets. We can do this." And they just go off on their own and they don't really know what they're doing. And it's just so dangerous. And
sorry, what was the name of the code of practice you mentioned?
The SCAS Code of Practice.
Oh, right, okay. Yeah.
It's now called the SCAS Code of Practice for Animal-Assisted Interventions. But the name of the protocol has changed to services because in some countries, an intervention is a loaded negative word. So it's now animal-assisted services. So yes, the schoolwork took me, it just expanded and expanded into all sorts of areas. When I went to visit the different professions in town, people were very interested in learning about the bond and how it applied to their work. And I did projects with many of them. So that was really rewarding.
I was just going to say, if you could specify the time period, because I think it's important for our listeners to realize this was not 2000 when people were talking about the bond. This was much, 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 much earlier in the 80s, right?
Yeah, so I started this in 1984 and we did it for 28 years while we owned the practice. Because when I go to vet schools, the students are, "How do you get time to do all this?" And I say, "Look, I've been doing this over 40 years. It's not in a week. You start with one project and then you just expand. The other thing that we did was we pioneered bond centre veterinary practice. So everything in the practice was focused on the human-animal bond. Now, when we were students, there was a lot of discussion. People say, what do we do when we qualify? Should we do what the client wants because they're paying the bill? Or do we advocate for the animal because that's an animal welfare issue? But if you focus on the bond, it just sorts everything out. If a bond, so during every consultation, as well as diagnosing the problem and giving a treatment, I'd be looking at the relationship and determining, is this a good enough relationship? Could it be better? What can I do to make this relationship better? And occasionally you see a relationship that's just not working at all. And then you think, can I get it to work? Can I help them to fix this? And if the answer was no, then we would make efforts as a practice to disentangle the bond and rehome the animal. But that has to be done very carefully. So bond centre practice has a lot of key elements in it. So if we just go to the beginning, we would encourage clients to come, if they were thinking about getting any sort of animal, we'd encourage them to come to the practice so we could talk to them and learn about what their expectations were, what's their experience, what time do they have, what can they afford, what animals are you thinking about? And then we could steer them often away from what they thought they wanted to something that was going to suit. A lot of people, though, they're just so impulsive about getting animals that they don't come to surgery first. And that's so upsetting. So the ones I remember are particularly older, frail people coming in with or saying they want a German Shepherd, an Akita, a Doberman, a Labrador. And then I and the rest of the staff, we'd invite them to have coffee and we'd sit down and we would try our best to steer them towards something easier. But some of the older people, one of the medics that was on the board said, some older people behave like children and they just don't want to give in. They're very stubborn. So we had a few older people who, despite the best advice, went ahead. They got the German Shepherd, they got the Akita, they got the Doberman, they got the bouncy Labradors, and then they couldn't cope. And that was the incentive for writing the SCAS book on pets and older people. And it's so hard because people, they sometimes say, but I've always had a German Shepherd. I've had 12 German Shepherds. I can manage them fine. But then we see them getting pulled over in the street. And they could have a German Shepherd that lives till he's 15. They're then thinking of getting a puppy. But that 15-year-old dog by the time he's 15, is a very well-behaved dog. And they're 15 years older. So I would actually start, when people were in their 40s, I start to say to them, they come in with a big breeder, say, I'm just wondering what kind of breeds you're thinking about in the future. And they'd go, what do you mean? I say, well, my husband and I, we were always into boxers, but now we're into terriers. It's so much easier, And I'd talk about the cheaper to run, the cheaper to feed, the cheaper vet treatment comes cheaper. You can go out with them for the day, and if I went on holiday, there's lots of people would offer to look after my dogs, but not when I had a boxer. And some of them we could get through to, but that's just one of my things that upsets me. Interestingly, when I was in Japan looking at pets and housing, I learned that a guy that owned an island had built high flats, multi-story buildings, and let people have dogs. But the prerequisite was they had to have a dog that they could carry. Because if the lifts broke, they had to be able to carry their dog up and down the stairs. or if there was a fire, they had to be able to carry their dogs. And that then meant that older people were then restricted to small breeds. And I thought that's actually quite sensible.
And also older dogs, right? So we'll put
Yeah.
a link to that book and some other resources in the show notes. But yeah, I mean, shelters, they have a hard time rehoming the older animals, which, yeah, require less exercise and...
Yeah. I actually had a client come to me when he was 50 to thank me for all the help that I'd given him and his pets over the years. But sadly, he wasn't going to have any more pets now. And I said, oh, I'm thinking, is he terminally ill? What's wrong? I said, oh, what's the reason behind that? He says, well, I'm 50 and you don't know what lies ahead. And I don't want to predecease a pet. And I said, well, you know, if you come to our practice and you predecease your pet, we will find a suitable home. But you can also adopt older animals. And he said, older animals? You mean you don't have to have a pup or a kitten? I said, no, you can adopt older animals. And he was like, wow. Oh, that's amazing. He was so pleased. And we had a cat sanctuary. We built a cat sanctuary attached to the practice. There was no animal shelter in our town. And we were rehoming between 50 and up to 100 cats a year. And a lot of those were adult and older cats. In fact, we dissuaded older people from having kittens because sometimes they found them too much work. But they were very pleased to adopt older animals. And it's just something that a lot of older people don't think about.
Do you find any difficulties with adoptions in the UK to people who don't meet criteria? I'm not talking in your personal, in your animals that you would help get adopted. I work with a charity in the UK who helps adopt animals from abroad into the UK. And part of the reason for that is that the people who come to them have been turned down by some of the major rescue adoption places because they don't fulfill X, Y, and Z. Can you just...
Yeah, I found that. So I came across organisations that wouldn't adopt to people with children or to older people over 65. And most of the people that we were adopting to had children. A lot of the people were over 65. I couldn't understand the mentality. But I noticed a difference when I was in American animal shelters. I mean, I worked, when I first qualified, the charity clinic that I ran was run in conjunction with an animal shelter in Glasgow. And I found, and then also I volunteered for a shelter before I went to vet school. And I found that there was more of an attitude in the UK about people working in shelters feeling unhappy and sometimes aggressive towards people because people were causing all these problems. When I went to America, I was very surprised at how nice the shelter staff were being to people who were surrendering animals and to people that were adopting. I thought this is a completely different approach because they didn't want people to feel bad. They were encouraging people to surrender if they couldn't care for the pets because they didn't want them abandoned. So they were being nice to them when they came to the shelter. And that for me was something new. It changed my behaviour because when I was a young vet, I used to get very angry with people that were giving up the pets. And I remember in the charity clinic, a lady came in with a beautiful Springer Spaniel and she said, I want you to put the dog down. And I said, why? She says, because I'm going to Canada and I'm not taking her. And I got angry with her. And I said, just leave her with me and I'll rehome her. And she stormed out of the building and she said, if I can't have her, nobody shall. So over the years, my husband and I, we developed a technique. If people phoned up and we didn't know who they were and they wanted an animal euthanized and we didn't know the background, we asked our staff not to ask any questions, just book them in with a smile, but give me a half-hour slot. And then when they come, we're going to act that I'm absolutely shattered. I need a break. I need a cup of tea before I can continue. Bring in some shortbread. Ask them, do they want to join me in a cup of tea? Bring the dog or cat into my consult room. The seats were in a semicircle. And we sat down and I just say, oh, I've been up all night. I'm absolutely shattered. I can't go on until I get a break. Just, will you have a coffee and a cup of tea and a biscuit with me? And I'd just sit and we'd just chit chat. Oh, isn't the weather a bit better today? So what's going on in your life? Blah, blah, blah. Oh, you're emigrating. Where are you going? Canada. Whereabouts? Oh, that's fabulous. Oh, what a beautiful country. And have you got kids? Oh, they'll love it. Oh, that's wonderful. And we'd chat like this. And then we'd finish the tea and I'd say, so what can we do for Sophie today? Well, brought her for euthanasia because we're not taking her. And I'd go, oh dear, well, don't worry. We've got a protocol. So what we do in cases like this, I will become her guardian and I will find her a family that's taken as good care of her as you have. So you don't need to worry. You just sign this consent form, but it's not a consent for euthanasia. It's a consent for me to become her guardian. It's been so nice to meet you and thank you for taking such care of Sophie for all these years.
Did you not get overwhelmed with people realising that that was a service that you provided and therefore lots of people would come and try and, okay, so it was manageable amount of...
No,
yeah.
I mean, other people would just come in and say, I don't want this cat or dog anymore. And we'd say, fine, and we'd admit them. Get them signed over. You've got to get them signed over. I learned that the bad way. So I had a guy came in with a border terrier with a fractured dislocated hock, and he was very angry with the dog because the dog had run away and got knocked down. But he hadn't had the dog on the lead, but he got angry with the dog. He had a wee boy with him, about 8 years old. And he says, what's it going to cost to get this fixed? And I gave a ridiculously low price because I thought this dog's life's in the balance. So I made a ridiculously low price. And then he says, what's it cost to have him put to sleep? And that was a lower price. And he's turned to his wee boy and says, right, we're leaving the dog. We'll just have him killed. And I didn't get him to sign the dog. I just said, well, I'm not doing that. I said, I will repair his leg and rehome him. And he just went, okay, right, fine, we're off. And I should have got him to sign, but I didn't. Anyway, we did the fracture repair. The dog was rehomed to a lovely couple who were in a different town, but one day they came to our town and the pup was recognised and they said they wanted the dog back. Guy came to the surgery, said, I'm having my dog back. And I said, well, we'll just make up the bill of what it actually cost. So the bill came to hundreds. And he agreed to leave the dog with the new family. But that was a close shave.
So that was a lesson. Well, that was
a lesson. And you also, if you're going to, if somebody brings an animal in for euthanasia and you don't get them to sign that it's not going to be a euthanasia, as a vet, you're going to be in big trouble if you endeavour to heal the animal and rehome it.
I see some of the vet prices in the UK now are astronomical. I'm sure that must be affecting people's abilities to be able to keep their animal, even if they have a massive bond. I mean, I was talking to somebody the other day and they had a price for, I think it was just a blood test. It was £600. It was just insane. Have you noticed any kind of increased abandonment stroke, relinquishment stroke, trying to readopt because of vet prices?
I just know from the animal shelters that this is a problem. And I mean, the way that my husband and I practiced, no animal ever went without treatment. So we did a lot of, we worked with animal welfare organisations to help fund treatments. We did things at cost. We would let people pay things up over time. We would barter with people. So if somebody was a gardener, we'd say, well, if you can do the garden, we'll do this. If they were a painter and decorator, they could do some work around the house or the practice, and we would do whatever. We would say to people, you know, if they were well known in town, say guys that went to the pub, take a hat, go around all the pubs, tell them what's happening. We'll do it at cost, but you get some money back. And we did a lot of pro bono when there was nothing else to do. We'd do it as pro bono, and we do it as part of our CPD and our nurses CPD. So we did surgery that normally we would have to send off to university, but there was no way of people affording that. So we would do it as part of our CPD.
That's a clever idea. Yeah.
And I have to say that everything, all the heroic surgery that we tried, it worked. So it was a win-win. We learnt new techniques, animals got the treatment, the nurses got more training. And personally, I don't understand why more vets don't do pro bono work. In the legal profession, it's something that's regarded very highly. In the veterinary profession, when I've spoken to other vets about do pro bono, they look at me as though there's something wrong. Why would you do that? You know, I've come across some vets in the USA that have run pro bono clinics because they don't have provision over there like we do with PDSA and RSPCA clinics. So some vets on their own have set up pro bono clinics.
I wonder, at least here in the US, if part of the problem currently is a lot of our small individually owned practices have been purchased by these large conglomerations. And so we're losing the small family-owned practices now. And I wonder if that's part of the problem, is that the bigger corporations don't have that flexibility.
Yeah, I mean, I'm hearing this from vet students. So some vet students have come to me in tears to say they would like to run a practice the way that we run ours, but they've seen practice at corporates, and some of them have thought they're just going to leave the profession. I mean, I think the financial thing might be why so many vets leave the profession, and it could also contribute to a high suicide rate. Because you train for years and years, your whole life is about saving animals and helping people. And then if there's a financial issue, that's very difficult.
Yeah, for sure. I mean, I know that there's a review going on. You probably know a lot more about it than I do, into the veterinary charges in the UK at the moment. You've heard about that, I would assume. Yeah. Do you know when that report is supposed to be coming out, or no?
I don't know.
Yeah, but Michelle, you're absolutely right. I mean, as far as I understand, and Liz could obviously knows more, but there are more national companies now taking over the small practices. So therefore, as from what I hear, is that there are specific fees that have to be charged up front, like consultation fees before anything starts, like for 150 quid, which is an awful lot of money in the UK at the moment for people.
My understanding is half the practices in Britain are now owned by corporates.
That's an awful lot.
But I wouldn't have been able to sleep if I hadn't practiced the way that we did.
Okay, so thanks for joining us on the Amphizoology podcast. It's been great talking to you, Dr. Ormerod, and we look forward to continuing our conversation. So until next time, we'll wave goodbye from the Amphizoology podcast.
Thank you for having me.